That's it's a really difficult question. I remember that being cultural sensitivity being a large component of my medical education. Um, it wasn't really taught necessarily in specifics, but I think in a more comprehensive way. So, there's no formula to necessarily practicing culturally competent care because it's really difficult for one to assume the ins and outs and expectations of one's culture or another's culture. So for me, it's as simple as taking the time to listen, taking the time to show respect for the first person in front of you, and developing a relationship with that patient. If there is something that I do that might be a faux pas, and I perceive that, whether it's verbally or non-verbally, I make sure that I ask about it. I make sure that I am curious because I think curiosity engenders a mutual respect when it comes to these sort of things. And so, as an example, I have a patient that, for her, contact in terms of shaking a man's hand is not acceptable. And I didn't know that before I attempted to shake her hand. And, her brother was there to politely point that out to me. And, we've come up with another simple namaste to say hello. And it is something that she laughs about because she remembers that time I made that mistake. And then in her mind, she thought it was funny because I was clueless, which I was. But I think, I took it in stride, and she did too, fortunately, because I think of the demeanor and the attention that I gave to the situation. And so I think if you take that approach, no matter the culture of the person that's in front of you, you'll have success in maintaining or developing a good patient-doctor relationship in the long term.